Hi, my name is Anna and I'm a manual lymph drainage therapist. Manual lymph drainage, or MLD, is a type of physical therapy designed to move the lymphatics. It's slightly different from massage in that massage is mainly designed to move the blood circulation and to physically manipulate muscles, and manual lymph drainage is designed to move the lymphatics as part of the lymphatic system. To learn what the lymphatics do, you need to know a little bit about blood flow. Basically, every part of the body, tissue in the body requires blood flow to and from it in order to take fluid to that area, oxygen to that area, and nutrients to that area. The blood flows down through arteries and then flows back away from the tissue in the veins. However, not all of the fluid and all of the proteins are removed by the veins. Only about 80 to 90%. The lymphatics remove the rest of the fluid and the larger proteins. This includes viruses and bacteria. So what the lymphatics do is remove viruses and bacteria and sometimes other toxins from tissue in the body, and also removes excess fluid. So if there's inflammation in an area, as the inflammation goes down, that's partly because the lymphatics are removing the fluid from that area. Manual lymph drainage is a very light touch. If we work deeply, then what we're doing, if you have a deep massage, your skin glows an ice red colour, and that's because you're increasing the blood flow to that area. We do not want to increase the blood flow in manual lymph drainage because that increases the fluid brought to that area. We want to increase the fluid removed from that area by the lymphatics, and therefore the touch is very light. It's literally about moving skin, not about working into the deep tissues. Therefore, manual lymph drainage should not hurt. If it does hurt, then it's worth telling the therapist and they can adjust the kind of touch they're using on you. However, we do work over some very painful areas, but because we're working lightly, it shouldn't ever be painful. There are a large range of qualifications that you can get in manual lymph drainage. I've heard of people doing half-a-day course in manual lymph drainage. However, I'm a member of MLD UK, and that's a national group of therapists who require the manual lymph drainage therapist to be qualified properly from internationally recognised schools. I'm a VODA trained therapist, and so part of my training was in Austria, in a clinic in Austria, and lasted over 4 weeks of training scattered over a couple of years. One way to make sure that your manual lymph drainage therapist is properly qualified is to contact MLD UK. A treatment lasts around about an hour. I prefer to do 1 hour and a quarter bookings because that gives me time to have a thorough consultation with someone before the treatment, and then they can still have an hour-long treatment, an hour-long session, which gives us enough time to work on each of the problem parts. There's no reason why you shouldn't let your doctor know that you're receiving MLD. Manual lymph drainage is performed in a number of clinics and hospitals around the UK, and it is a recognised form of treatment for a number of different conditions. By all means, let your doctor know that you're seeing a qualified therapist to have MLD. No, there's no age limit. I have treated a 5-year-old and I have treated people in their 80s, but there's no reason why I can't treat anyone who's younger or older than that. Because in manual lymph drainage we want to move the skin, we don't use oils. However, we do have skin-to-skin contact, so you'll be asked in general to undress down to your underwear so that we can have skin-to-skin contact in the areas that are problematic. VODA-trained therapists always start off by working around the shoulder and neck region. After that, we tend to work on the areas that are problematic. The movement is light and repetitive, and for that reason some people can find it hypnotic and very relaxing. We tend to work over a small number of areas for a length of time, as I say, repeatedly, and this has a beneficial effect on the lymphatics. In the NHS, manual lymph drainage is used to control a condition called lymphedema. Lymphedema can occur in arms and legs, and also in a number of other regions of the body, including the face, the back, the chest. However, it's also useful for a number of conditions where inflammation is a major part of the condition. Therefore, it is good for arthritis, it's good for swelling in the feet and hands during pregnancy. The number of reasons people see me are really wide. Some people just come for relaxation. As with any therapy, one single treatment is unlikely to resolve an issue that has been ongoing for a long time. Therefore, a series of treatments are normally required. This series of treatments could be over a short space of time, so maybe a few treatments one week, a few treatments the next week. Some people do that because they're going through a detox, or maybe because they're treating a specific condition, like trying to reduce the size of a limb in lymphedema. Other people just come over regular intervals, so once a fortnight, once a month, and that tends to be to keep an ongoing condition manageable. The majority of people I see either see me now and then for top-up treatments or once every 3 or 4 weeks to keep a condition manageable. I use kinesio tape on a number of my clients after I have performed the manual lymph drainage. Kinesio tape was developed in Japan to help with the rehabilitation of a number of different conditions, whether they're sports injuries or inflammation, and it is used throughout the UK in the treatment of lymphedema. What's special about kinesio tape is that it is stretchy. And it's this stretch that we use when applying it to the body in different ways to have an effect. That means that the lymph drainage treatment that you have got over an hour can continue once you've gone away. Hyvermat 200 is an instrument that is starting to be used to supplement a number of therapies, including manual lymph drainage. It works by using static electricity that's built up between the client and the therapist. And I'll demonstrate on Ed how it is done. Ed, can I have your hand? Thank you. And if you hold on to this electrode, and I'm going to attach this electrode to my skin, there, and turn it on. While we're both holding an electrode, because I'm wearing a vinyl glove, no electricity can pass from me to Ed, yet static electricity is built up, and a deep oscillating effect is produced in Ed's tissue here. This effect can work up to 6 centimeters deep, although the touch I'm actually giving Ed is very light. So I can have an effect up to 6 centimeters deep in Ed's tissue without actually putting a lot of pressure on. And this can be very beneficial in a number of different therapies, particularly when there's pain. About 7 or 8 years ago, when I was a massage therapist, a couple of my clients were looking for someone who performed manual lymph drainage. They had been recommended by friends on the continent to have manual lymph drainage and have been told that they had to go to someone who was properly trained. And they were having difficulty finding someone who they considered, or their friends on the continent considered, to be properly trained in manual lymph drainage. Therefore, I started looking to find out more about this treatment and to see what I could do to train as a manual lymph drainage therapist. I was recommended by nurses at Cancer Backup, a charity that supports people through cancer therapy, and to look at a group called Manual Lymph Drainage UK, MLD UK, and through them I found courses teaching VODA MLD. That way I ended up in Austria learning manual lymph drainage at a clinic that treated lymphedema.